Engineer in the Ministry of Health in Benin. He has attended many workshops with WHO, and he's also been an expert in WHO expert consultations. He has been also a reviewer of innovative health technologies for the compendium, WHO compendium. So without any further ado, I will ask Tom if he could please let us, if he could present Pascal's presentation, because he's unable to join us by internet right now. But,
thank you, Adriana.
So thank you.
For all of these sessions, we have dress rehearsals, and Pascal was very involved. And so you see, he wanted to give a snapshot of the case of Benin. Next slide, please. And basically, the story he's telling is that it's early in the buildup of patients, but as we all expect, there's a wave of patients coming to many countries in Africa right now, and we're anticipating that and trying to help work with that. You see there is a very steep rise in cases most recently. Next slide. And so far there has not been major COVID-19 incidents, but they're expecting a lot more, and they want to do the best thing for patients. And as we've just heard, this approach that Dr. Donner has talked about is less invasive and more simple. And they also are lacking ventilators, so they want to do the right thing by these patients. Next slide. So he's given an overview of how CPAP helps clinically, and you've heard a story about that extremely well in the last few moments. So I'm going to pass to the next slide, please. So these are some of the devices they're planning on using as they experience these kinds of patients coming up, and maybe these can be of help to you. Next slide. So in closing, he sees in Benin, even though the wave has not hit there yet, they expect a CPAP to play a very important role. But here's some lingering questions he wants to leave for us is, you know, they want to be prepared with maintenance and training. They need oxygen. Concentrators, we've talked about that last week. And will they have enough pulse oximetry? So we'll help them address that with Adriana. Okay, back to you, Joel.
Thank you, Tom. Maybe we could try to go to your questions, because you ask many questions on the QR that dashboard. Many of you ask questions, and I think Professor Donner could answer this one. What is the